This is an assessment for hip internal rotation. So we'll go onto your back, and I'll show you from the front on view and then kind of from behind. But you'll be on your back. Once you take your fist, bring them together, fist down, and you're going to bring them just inside of your knees. So you'll lift your feet and your legs up. And I want you to push your knees into your fist. So pushing in, you're going to feel a little squeeze in your adductors. And then from there, I want you just to rotate your shank. Let's go to right leg. Just rotate that shank out and see how much of your leg you can see from the outside of your femur, your thigh. So we'll do that on both sides. So take the right leg out, just see how much you can see of your leg there, and then vice versa. On the left, same thing. And then from this angle, same exact thing. I'm going to rotate my right shank out, and again, looking to see how much of my leg do I see. Do I feel any pinching symptoms in the hip? And then do the same thing on the left side. And just notice, is one side more mobile than the other? Are you able to see more of one part of the leg than the other side? And then from there, we'll go into a simple exercise that will work on, we call it the posterior joint capsule of the hip. So in order to have internal rotation in the hip, you have to have the adequate mobility in the joint capsule. So once you get into a 90-90 position, okay, if this is too hard or you can't get into this position, that's okay. I'll show you a modification here in a second. So we call this 90-90 because your knee's 90 degrees here, your knee's 90 degrees here, okay? So from there, I want you to lean forward. And the goal is you can get your palms in front of you. And what we're going to do is we're going to work this range here to here. So just kind of going out in front, you're going to lean your trunk, your chest forward as far as you can until you get a good stretch in the back of that right hip. We're going to stay here. And we're going to take 3 deep breaths. So when you breathe, I want you to think about just expanding that rib cage. And on the exhale, just try to sink into it a little bit more. And again, you can do that in this plane as well. And just kind of play with that angle. So I'm facing straight on, so this would be kind of working that 9, 10 o'clock to 12 o'clock range, okay? Then we'll switch sides. So we'll go left leg in front, right leg behind. You'll do the same exact thing. You might notice one side might be harder than the other, right? So it might be harder to get over, to get that stretch. So you might have to, in this case, work more in that 11 to 12 o'clock range. It might be harder to go, say 12 to 2:30, 3 o'clock. But just do what you can that's comfortable to where you can just get that stretch in the back of that hip. Okay, so we'll go the same thing there. And since I did my right side the most, then let's reassess that right side. Let's see how much range of motion that is increased. So the same exact thing, we'll go back to that test. Push my knees into my hands, my fist, and just rotate that right shin out. And I already see more range of motion here just by doing that small little movement. Okay, if that 90-90 position is tough for you, then we'll stand up and get into more of a golf posture position, and we call this lower quarter rotation. So I'll be into my golf stance. I want you to go hands on your hips. And then from there, you're just going to load into your right hip, almost like I'm trying to get my sternum, my chest, over my right heel, okay? So just loading into that right hip, again, until you feel a good stretch in the back of that right hip. So when you get to this position, I want you to kind of get to that in range, maybe take 8 to 10 little bounces there, and then come back out of that. And then we'll go one more time, 8 to 10 bounces, and then back out, and then vice versa, same thing on the left side, just loading into that left hip. Should feel a good stretch in the back of the left hip. And then we'll do that two rounds, 8 to 10 times. and then go back and reassess that test, and you should have more range of motion.